So we tried to work with health, but found it quite a complex, difficult system to navigate. So we went on a HACT programme, which sought to demystify health and help us as housing specialists understand how to work alongside them collaboratively for the best of our residents. So WHG, in its corporate plan, committed to improving the health and wellbeing and the health prosperity of up to 10,000 of its residents over a 4-year period. We knew that we needed to do that in partnership with others, that we couldn't do it as a standalone organisation. And we also knew that, unfortunately, that people lived in social housing were dying up to 10 years earlier, or were dealing with chronic illness or disability and therefore living their later lives in pain and not having a good quality of life. So we made that commitment as an organisation, and through a co-design approach with our customers, our colleagues, our board members and wider residents and other partners, we produced the health and wellbeing strategy, which we call the H factor, which is health, hope and happiness. And the premise of that work is to promote opportunities and increased access to health services to improve our customers' general health and wellbeing and help them to be healthy, happy and have hope for their future.
Came about after having done some work with Connie Jennings, who's now Director of Stronger Communities. She attended the ICS development programme a couple of years ago, and on the back of that she obviously saw what benefits there were in working with HACT, in understanding how health and housing could work closer together. As part of that, then we went on to deliver an evaluation of the social prescribing programme that was being run from WHG, and that's just all snowballed really in our relationship together. We started to see the opportunities that there were to start rolling out to the rest of the Black Country what was happening and working so well at WHG.
Okay, so this is a journey that started a couple of years ago, and it was through a conversation with Walsall Housing Group where we were talking about how can we better support some of our more challenged communities in Walsall. And we quickly recognised as well through that conversation that their housing customers are our population that we want to serve. And so there's I would say maybe commonality, if you like, from the start. And so we started to talk about, so what could we do together to better serve that kind of common group of people, their clients, our population, like I said. And we started looking at community champions, building on some of the work that Walsall Housing Group had already done around social prescribing. And so these community champions were then commissioned by us a couple of years ago, and it was very much about recruiting people with lived experience of diabetes, either as a diabetes sufferer themselves or as a carer of somebody with living with diabetes, type 2 diabetes. And so that's where it started. So we recruited through Walsall Housing Group these community champions, and they started doing the work around promoting health in Walsall. But also what that project did is it also offered those individuals that were recruited gainful employment, meaningful employment, actually, in Walsall. And so I started to see then that actually this could be really, really powerful if we worked with housing providers, because actually when you look at the data, it shows that at least about 40%, nearly 40% of our kind of population or patients, if you like, those who have been diagnosed with an illness, are drawn from a social housing sort of background. And so that's quite a substantial proportion of our population. And so it necessitated that conversation with housing partners around how do we better serve these communities, but also how do we, in terms of addressing that whole deprivation aspect, how do we then also create opportunities for gainful employment for our local folk. And that's how that conversation started. Now, the most easy way, or I would say maybe even the first port of call in terms of addressing healthy life expectancy through prevention, is having a roof over your head. And that's why, for me, working with housing has got to be the way forward. But also recognizing that their customers are our population, and more frequently than not, our patients. And so we've got to work with housing in a completely different way to drive through prevention, because that's the way that we're going to address the poor health outcomes that we have across the Black Country. That's the way we're going to deliver population health. That's the way that we're going to address health inequalities. And that's the way that we're going to create value in the way that we commission services across the Black Country. That's the way that we're going to increase productivity, because we're recruiting locally. And that's the way that we're going to support that broader socio-economic development across the Black Country as well, creating gainful employment for local people.
I think what housing has brought to the health agenda is a realisation that if people's basic needs aren't met, then they can't worry about the things that health want them to worry about. And therefore, I think what we've managed to do is humanise people in the population for our health colleagues, and be able to bring their data to life. So when they talk about, childhood obesity or COPD levels, or the numbers of people with diabetes, we've been able to give them, life stories of people that, with a little bit of help from a champion, we've enabled them to get on the care pathway, and therefore improve their overall long-term outcomes. It's a low-cost approach that leads to big savings for the health service, but also, more importantly, it improves lives and increases the quality of life that people have.
Watching that journey has been really exciting, and certainly within the groups that we've had so far, the days that we've had so far, the excitement that's generated, because people are seeing, well, actually, this isn't impossible. This is proving that this is possible. We don't have to be afraid of things that we don't fully understand. The thing is to embrace it, tackle it together, and then really achieve the ultimate, which is improving the lives of the people that we work with on a day-to-day basis out in our neighbourhoods and local communities.
For me, success would be if partners sit together and talk about these areas of mutual concern. That for me would be a huge success. Just sitting around the table and recognizing that we've got a mutual problem here that we need to address. We need to do better for our population across the Black Country. That for me is success, because I believe that action begins with will, the desire to do better. I think for me will be great success. And then if we move into action, it's about doing things together. Rather than thinking that the NHS has got the solutions by itself. That will land us in a place where we will continue to do the same as we've historically done, and we'll continue to get the same results, which are poor results. But if we start to work together and really put our heads together and sit around the table together, I think we can come up with really innovative solutions that can drive health improvement across the Black Country. And we're starting to see some green shoots, like I said, in Walsall, through that Community Champions project that we commissioned. We're starting to see partners coming together through the work of the Health and Housing Partnership Manager. I think we can continue to build on those really solid foundations that we've put in place in the Black Country and see maximum health benefit for our patients.